It seems to be that there is some benefit to increasing, what's called the GKI, the Glucose Ketone Index, to lower your glucose, increase your ketones, and it seems to facilitate prolonged life, decrease the likelihood of metastatic disease. And in some cases, we've seen regression. I've anecdotally talked to patients. Again, this is anecdotal, so you can't necessarily, you don't want to discount it, but you can't say it's super solid science. So I do think there's benefits. I've talked to a number of patients that have gone through cancer treatment, particularly chemotherapy, and they've done a carnivore diet. And what they have noticed and what their physicians seem to confirm is that they have basically almost no side effects. I mean, they sort of blow through this very, very nicely. So at the very least, it should be considered as a beneficial adjuvant, to any kind of therapy out there. I'm not saying you should just forego all normal cancer treatment and just do a ketogenic diet. There are some people that would say that the outcomes are better, but I'm not an oncologist. That's not my wheelhouse, but I can tell you, I've seen a lot of people with cancer, either, improve their survivability, it maybe getting an extra 2 or 3 years versus, a few months, with this. So I think there's something there for sure.
Beneficial adjuvant. I like that. That's a nice way to put it. And glioblastoma in particular is interesting because there has been no improvement in treatment outcomes or just outcomes in general with new treatments over the last 80 years. It's been the same until you look at what Siegfried and Tomasz Dudaj, who was one of his postdocs that I spoke to about this, they've been doing that. And so they're the ones that put that work out there. Very, very interesting.